Hello. Hello. It's me, Dr. Catherine Toomer, and Dr. Toomer Talks. So I am Dr. Toomer. For those of you who are tuning in for the first time, I'm Dr. Toomer. I'm a family medicine and community health physician. I'm also a weight care specialist, and I focus on a biopsychosocial approach to whole person weight health, and which basically means I look for the cause of why people gain weight and then go after it, and then it leads to lifelong weight loss. However, I also help people gain weight. So it's a weight care program that I have. And so for anyone who's interested in perhaps finding out if I can help them, they can always go to my website, drtumor.com, and contact me that way. And then we'll talk. I have free consultations, so we'll talk. But today, what I wanted to talk about actually was Oprah Winfrey. Um, a lot of people have their opinions of what she's like, and some people, particularly in the weight loss space, are a little upset with her because of her connection to Weight Watchers, which has led to some of the negativity we see around diet culture, but also because of her initial shaming of those who use GLP-1s as the easy way out for weight loss, and then turned around and then started using them herself. And for that, I have to say, listen, she is someone who has struggled with her weight her whole life. And so she has had that weight shaming, that weight phobia, that fat phobia internalized as well. She's no different than the rest of us. Yes, she's a billionaire, but that did not protect her whatsoever. It also didn't protect her from her weight struggles. And so I want to talk about what she's done, because it's really something that I talk about a lot and that can help a lot of people. And it's so important. So what I'm going to talk about actually is chronic metabolic weight gain, or weight syndrome, really. It should be considered a syndrome. Is part of a metabolic syndrome. And what we call it is obesity. Now, one of the reasons that I have a problem with everything being termed obesity is because somehow within the medical profession, we've tied obesity to body mass index and body mass index only. When those of us who have been obese, those of us who have metabolic obesity, even when we lose weight, that metabolic obesity, the processes of that metabolic obesity do not go away. I have lost 107 pounds. I am still dealing with blood sugar, and I still have to treat my metabolic issues to prevent that 100 pounds from coming back. And that's the case for many people. And that's why it's so important to understand what this is and why this is. We've been told this false narrative that all weight gain is calories in, calories out. When in fact, what it is that if you take two people who eat exactly the same thing, who have the exact same activity, who are the same height, their bodies will not respond to food in the same way. When someone is very thin, and we do this all the time, when someone's really thin and they eat whatever they want and they stay thin, we always say, oh, they have good genes. Well, the same is the same for the opposite. For those of us who don't have to eat very much, our bodies just take food and hold on to it. And that actually is because evolutionarily, those who are able to make more fat out of very little food were those who survived. Because it used to be where we were feast and famine, and those who were able to make a lot of fat out of a little bit of food survived the famine, and the others didn't. And so it is somewhat genetic that became maladaptive as we modernized. So so it is very important. So what it is, again, is a metabolic chronic weight issue, or metabolic chronic syndrome that results in weight gain. And weight, again, is a symptom of something else. It's always a symptom of something else. It is never weight in and of itself. Weight just shows that there's something going on, and it's really important to figure out what that something else is. And so usually it's a metabolic process of some type, hormonal, metabolic, something. And so with Oprah Winfrey, the reason I talk about her so much is because, again, just because she's a billionaire did not protect her from that. It's her genes. And so she had been struggling with weight her whole life. She's been going back and forth, up and down and up and down. And it only stopped when she started using a GLP-1 medication, because that is why they work, because they act on metabolic weight gain. Again, not all weight gain is bad. You can gain weight from muscle, and that's good weight gain. But in her case, it's fat. And that's why we really talk about weight when really we should be talking about fat, because weight is not the problem. Fat is. Because in our body, fat in and of itself is an endocrine system. And so it causes inflammation, it causes gene mutation, it causes cancer issues, mainly because it drops our immunity. All of us have cancer in our body, and it's our immune system that keeps it from growing into cancer. And when you have excess fat in your body, that system gets disrupted. And so you're more likely to get cancer. You're more likely to have end organ problems, liver disorder, kidney disorder, heart, brain. And so that's why it's so important. Weight, again, doesn't matter. Fat is the issue. And so we're really, truly trying to reduce fat in the body. And you can be skinny and over fat. Just because someone is overweight by number doesn't mean they have too much fat in their body, because they could be very muscular. And just because someone's thin doesn't mean that they're healthy and that they're not over fat, because they could have more fat than they do muscle. And so that's why it's really important really to focus on fat. I wish we could just get away with the weight discussion, the weight conversation altogether. And especially the BMI conversation, mainly because, again, if you have a lot of muscle, your BMI is going to be a bit higher. So yes, Oprah Winfrey has been using a GLP-1 to control her chronic metabolic syndrome, her chronic metabolic weight gain that we call obesity. And even though now she is thin, she still has that same disease. Many of us who have that disease, who have that syndrome, still have that process going on, even though we have lost our weight, we have lost some of our fat. And so that's why it's so important to have these discussions, because they're health issues, not fat issues, not even weight issues. And so that's why. And the other reason why it's also so important is because we need to change the narrative. You know, medicine is an apprentice educational system, which means that we learn by being shown what to do. We learn by being taught by those who learned the information before us. Unfortunately, what that also means is that other people's prejudices and phobias, particularly fat phobias, also get passed down. And so we still have way too many doctors walking around with their own fat phobias, their own prejudices, who have not taken the time to really understand what weight gain truly is, or fat gain truly is, and therefore how to help people combat it. And I can tell you, it is not all calories in, calories out, and exercise. And the reason I use Oprah Winfrey as an example, she has the money for a personal chef and eats very well. She does hike almost daily, and yet she was still struggling, and mainly because her body was fighting against her. And that's the case with many of us. And therefore, it's very important that we change the narrative so that people who are walking around with metabolic issues don't continue to suffer. And the reason it's important not to continue suffering is because it does cause damage. People with extra adipose in their body die earlier. It gives you fatty liver, heart disease, kidney disease, brain disease. It just causes joint disease. And it affects your immunity. It affects how your body functions in any given situation. It just disrupts almost every process of our body. And that's why it's so important. Pay attention. Doesn't matter what the weight is, doesn't matter what size you are. It really, truly just depends on your body composition and how much fat to muscle ratio you have, because you truly want your fat to be low, your muscle to be high, no matter your size. And because all of us are different sizes anyway, there's no one size fits all. There's no size for health. It's truly individual. So again, I'm Dr. Catherine Toomer, stepping off my soapbox. Thank you for those of you who have listened in. I know Chris wasn't able to be here today, has been here almost every week. Stacy, thank you for saying hello. There's some says Facebook user, so I'm not sure who you are, but thank you. Thank you for listening. And Dr. Uno, of course, I always appreciate when you're here because it is because of you that I am here. So if you have any questions, you can put them in the comments now. I'll be more than happy to answer them as best I can. And also, if you have any other questions later, even if you don't have them right now, you can put them in the comments below. I always come back and revisit. You can also go to my YouTube channel, which is youtube.com/Dr. Toomer. And if you comment there, of course, I get notified as well. Or you can go to my website, drtoomer.com, and leave a message there. You can also ask if you'd like to get a consultation to see if, one, if I can help you, or two, if I have some understanding of what your issues are, because I know people have questions. I know that there are those of you out there whose bodies feel like they've been hijacked and you just don't know why. And you're doing all the things you think you're supposed to be doing, and your body's just not responding. Trust me, there is something going on that can be found, that can be addressed, and therefore your body can function like it's supposed to. So, let me see. So I have a question here. What causes me to get so cold? Sometimes it changes my finger colors. Okay, so when you're cold, your blood vessels constrict. When you get warm, they open to send blood to your fingertips and toes and the smaller vessels. And when you're cold, they restrict. Now, there is an autoimmune disease that's called Raynaud's that can cause it to cause pain and really true discoloration. If it's just mild discoloration, it's probably simply because you have some constriction of your small vessels. The reason you're cold is if you've lost a significant amount of weight, you've also lost your insulation. Our fingers are fatty fat pads. And when we lose fat everywhere, we tend to lose our insulation, the thing that keeps us warm. Not to use the term blubber, but essentially in other animals, that's what we call it. And on us, it's just extra fat layer. So when we lose that, we do tend to get cold. And so in modern days, it's not such a bad thing. However, evolutionarily, that could have caused some problems. But so that's where the cold comes from. However, the other is to make sure there's no underlying anemia. Often when we've gone through a weight loss process, if there has been some malnutrition, which can happen from a drop in appetite, you want to make sure that your iron levels are where they should be and that your blood count is where it should be. And if not, then you talk to your doctor about replacement with iron and folic acid and vitamin B12 and vitamin C, which helps iron get absorbed. But Dawn, you asked a question. Sometimes it changes my finger colors. Talk to your doctor and make sure that they can check to make sure it is not an autoimmune issue, but rather just because that's just a physiologic change our body goes through when we get cold. Do insurance companies cover the medication? Yes, if the prior authorizations are done properly. Of course, it depends on your level of insurance. However, when proper testing is done, that diagnosis can be used to help shore up your prior authorization application. Unfortunately, we talk about BMI as being a criteria, which is over 30 or 27 if you have other issues, other medical issues. That's good if you're above those BMIs. But if you're someone who has a lot of fat in your system and you're under that, then you're sort of screwed, unfortunately, because insurance company won't help with the metabolic processes that you have. And there are a lot of people walking around with polycystic ovary syndrome who have insulin resistance, who are simply not over BMI, but their body is still functioning with a metabolic problem. And so when that happens, it's really important then to prove that there's something there so that you can then use that as a secondary diagnosis. So when you appeal, if denied, you can use that. It's a whole, this is where the art of medicine comes in, because unfortunately, we don't have a whole lot of control when it comes to medications, but we can do our best to fight to be an advocate. My dad is 70 years young. He has a question. Oops, where'd it go? Why do people gain after they stop the GLP-1? They gain because the metabolic process that the GLP-1 is treating suddenly goes untreated. It's the same reason why if you're on a blood pressure medicine and it's controlling your blood pressure and you stop taking it, your blood pressure goes back up. It's the exact same reason. The GLP-1 is for chronic disease. Obesity is a chronic disease, and it's treating the metabolic cause of that chronic disease. So when you stop it, the chronic disease is no longer being controlled. And so the weight comes back. Again, the weight is just a symptom of something else that's going on. And so just like if you take Tylenol and you don't have a headache, nothing happens. So when you take a GLP-1 and weight loss happens, it's because it's actually treating something. It doesn't work if there's no metabolic issue there. It can cause some early satiety or make you feel full quickly when you eat just because of the mechanical part, but that's a small part of what the medicines do, and that goes away. It's considered a side effect that goes away over time. It's all what happens in your head, your brain telling your body what to do, mainly because of metabolic process. Stacy Johnson says, I'm feeling better now. I have pre-diabetes and now on Zepbound 7.5 and it's working great. Wonderful. I'm so happy when I read things like that, because what that means is instead of waiting until someone becomes diabetic and then treating them and waiting until they have all the complications associated with diabetes, you prevent it. So treating Zepbound 7.5 is only half of the maximum dose. If it's working for you, that's wonderful, because what that means is that it was caught early enough to reverse it. So Dawn mentioned it only started after losing 100 pounds. Yeah, you lost your insulation. You simply lost your insulation. But really, just check with your doctors to make sure that if there is finger discoloration, just make sure that it's normal blood vessel constriction and not caused by an autoimmune disease. Okay, you said as soon as I warm my hands up, they turn back to normal color. And that's fine. That's good. But just still, if you start getting concerned, my rule of thumb is should I ask my doctor? The answer is always yes. Because if you're concerned, just for peace of mind, if for no other reason. So Stacy, thank you for sharing. It says, I'd like to share, I was at a BMI of 50, still was initially denied, had to fight the employer level, and now approved is granted. Thank you. Wonderful. And the reason is because, and we're all fighting, there's actually a wonderful organization out there called Obesity Action Coalition. And what we do in there is we fight and advocate for people to get medications. Right now, there are several lawsuits against companies who are refusing to pay for obesity, which is a chronic disease, but they'll pay for diabetic medications, which makes no sense. Instead of preventing diabetes, they're going to pay for diabetes. So there are some lawsuits out there just to say, for employers to pay for preventative medication, apart from the fact that this is life-saving medication, because the adiposity or the fat production that comes along with this is very dangerous, but it's also very costly. It costs a lot in lost time, lost productivity, and increased illness because of increased illness and all sorts of other reasons. And so fatigue, it's just so much, and it just makes no sense not to do something and to help people when they need it. So, any other questions? Any other comments? Um, again, you can always find me, leave comments on Facebook, Instagram, even, although I haven't streamed this into Instagram, but I am in there also under Dr. Tumor, and then YouTube. And as you can tell, I love to teach. I love puzzles and I love problem solving. So, if you have a question, if you're really concerned, we can find an answer. And if I don't have an answer, I definitely know who to ask to help you find yours. So, again, but don't let this go on too long, because if there is an issue, the longer it goes on, the more damage it does. So again, so I'm Dr. Catherine Toomer. Thank you for tuning in. Thank you for your questions, and thank you for your comments and for sharing. It's really important. And also, just so you know, I also have a free Facebook group. It is total weight wellness and weight loss. And so if you find it as total wellness and weight loss, even if you're tired and busy, and so you can go there, and I stream into there. I add a lot of information. I add there. And then once working with me, I have a private Facebook group for support and accountability as well. And so that is always open. Well, it's open for now, as long as it doesn't get too busy, because I still do one-on-one appointments, and I can only limit the number of people who I can work with for that reason. But I do have my weekly groups where we also have a lot of support. In fact, it's going to be happening in a few minutes. We have a lot of support, accountability, and a lot of sharing. And so that's also part of my program as well. So if you want more information, simply find me and I'll explain more. So good night. Thank you for coming in. If you're watching later, please put #replay. Share this with others. Follow, subscribe, share this far and wide. I truly believe that a lot of information is power, and I hope this information is beneficial to someone, and it will empower them to take control of their health. It will empower them to advocate for themselves, because ultimately that's what's most important. So good night.